57-year-old female who comes in today with complaints of migraine headaches. She states she's had headaches since the age of 12 but got better over time, but now it's gotten worse again since the birth of her second child. She said that they have not been this bad since she's 15 or 16 years old. The headaches she's having are every 2 to 3 weeks, and they last 2 to 4 days, which she's required to go to the emergency department for 3 times in the past 6 months, and she's gotten shots for the pain. She denies fatigue when not having a headache other than taking care of the children, but states isn't everyone tired when they have 2 children. She denies having a headache at this time and reports that she often vomits with her headaches and the pain is throbbing. She's married and has 2 young children, ages 18 months and 5 years. She works part-time on the weekends as a cashier at the local CVS, in which that time their father watches the children. He is a truck driver, and he's often on the road 2 to 3 nights per week. She did bring her children with her, and she stops frequently to correct the 18-month-old, who's just kind of freely exploring the room but getting into things, and screams every time she removes her from like a drawer or an electrical cord. She denies dizziness, weakness, doubled vision, or blurred vision. She has not had any weight gain or loss. Denies depression or anxiety, and states that the headache is usually on the right side in the temporal or parental region, although she says they occasionally are on the left side. Her vital signs are weight 145, height 5'3", temperature 98.2, pulse 88, respiratory 20, BP of 132/86. She perlas fine, has no peripheral edema. Her neurologic screening is completely negative. TMs are unremarkable, NAIRS benign, pharynx benign, no lymph nodopathy or thyroid swelling. Lungs are clear, and heart is regular rhythm without murmur, gallop, or rub. Abdomen soft and non-tender. She has bowel sounds in all 4 quadrants. Denies nausea, vomiting, or heartburn. My first differential diagnosis for her is going to be migraines. She is at almost the peak expectance for incidence for migraines in life, which is in the 3rd decade of life. She is 27. She is having migraines unilaterally, although she does state they're sometimes on the left, but most of the time on the right. She's had more than 5 attacks of migraines, and they do last 2 to 3 days, which meets the criteria of 4 to 72 hours. For her, I would recommend that she try some stress relievers. She does seem to be stressed with her children. See if she can maybe get some time to relax, have her do some relaxation training. And the relaxation techniques that I would recommend for her, I would also put her on Imitrex for the migraines and my second differential diagnosis of cluster headaches. She can have, I would put her on 50 milligrams PO of that once a day, and she can have a max of 200 milligrams within 24 hours. I would also give her some rescue doses of sub-Q that she could give herself if the headaches are really bad, and she can get that once, a max of 2 doses in 24 hours, keeping in mind that she can only have a total of 200 milligrams of the Imitrex within 24 hours. And for that would cover either cluster headaches or migraines for either differential diagnoses.
I would like to see her back in the office in a month. It does take a couple months for the headache medicine to be able to see if it's really working for her headache. So I'd like to see her back in a month, and then a month after that to see if she's gotten any better. Along with that, I would also tell her to come in if the Imitrex is not helping with her symptoms. Her symptoms are getting worse. There's no tests that I would like to run on her right now, but if the Imitrex does not work and she continues to have really bad headaches, I would want to do a head CT.